our public health system is that financing strategy is very weak. We have the CMP target of achieving 3% of GDP for public spending on health. We are still far away from that. I mean, we are still around 1%. We need to decide on funding using, say, the Canadian model of funding, which is block funding. That is, you decide, okay, on a per capita basis, all primary health centers will be funded.
The access of scheduled castes to the health does not mean that you have programs, the access is there. There is also an aspect of exclusion based on the caste identity.
The fact that the NRHM still is 1% after having pledged 3%, I think we just have to get our act together and make much more of a noise than what we've been able to do so far.
NRHM basically has given the government and the citizens a window of opportunity to accelerate the unfulfilled agenda that was put on the back burner in the last 20 years.
It was only in July 2006 that the National Rural Health Mission's framework for implementation was approved, which allowed us to engage nurses, doctors, paramedics, untied funds to local institutions on a large scale. The program, which has begun in July 2006, if you look at it in December 2006, how can you call it a midterm review?
Health insurance for family planning procedures, and I think we could have on JSY, a component should be bought under maybe 100 rupees of that should be part of the health insurance.
I found a great deal of change. Now I'll give you an example. It's a PHC somewhere outside Srinagar, about say an hour and a half outside Srinagar, and I found an incredible, incredibly run PHC there.
Alternate carriers for rural healthcare is the only solution, and a planning commission should go for that.
The health sector in India is the lack of states to actually comply to the promises made in the CMP, and the basic reason for that is the existing Fiscal Responsibility and Budget Management Act, which forces the government to restrict its deficit, to reduce its deficit. The government is trying to actually cut down the expenditure on social and economic sectors. I think at the first place there should be an effort to make a case against this FRBM Act per se, but for the timing if it is possible to keep the social and economic sectors out of the purview of the FRBM Act, that will actually help these sectors like health and education to a large extent.
We found over there that there are about 202 ashas out of 9 districts who have been taking money from the 1400 rupees that a person is supposed to get when she delivers a baby. We have to do something about mitigating this problem of the corruption that's taking place.
That we will never have enough doctors and nurses to go around. We have to get out of that paradigm. And in the Planning Commission, of course, there has been a report which was on health infrastructure that was reported yesterday in the media.
And we feel that very often we're working in islands where the civil society is talking among themselves about a lot of good things that they're doing. A lot of the policy makers and the members of parliament have their own forums where they talk about things that they're doing, and the government is talking within themselves. But where do we really see all these three really holders of democracy and governance, the media also coming together, and these 4 sectors really coming together and talking not just about tasting the rice that's in the pot, but actually cooking it. And that's where I really want to make this intervention, that this is not just a forum where we're looking at just talking about the problem, but everyone here has really been talking about the experiences that they've had where they want to solve the problem and be part of the solution.
As we review the NRHM, it has achieved expected targets in states like Tamil Nadu, where the health infrastructure had been already good. But when you look at northeastern states, the achievement is not in par.
Among the most important suggestions made by the Health Minister, Honourable Health Minister today, was the fact that people coming into the health system and not getting adequate services, especially for maternal health, should be covered through an insurance program which will ensure that all complications will be met by the best possible healthcare available in the